Reading. Good.
Ganesh, Bharati is the coordinator and Madhusri and Jinsi.
Jinsi, George, and Madhusri, they both are here, right?
Yeah, Ganesh.
Okay. We'll wait for a few more minutes and we'll start the session.
Okay.
Who is the coordinator for today?
Bharati.
Bharati. Okay. Bharati, are you here? Yes.
I'm here.
Okay, done. Great.
So have you all completed your tasks and posting in the main group once you completed your experience?
Yes, sir.
Okay, okay, very good.
Hello, good evening, Father
That's
and everyone.
very
Yeah, good evening,
important.
Vashra.
See, my simple this thing request is to you. We are starting with episode 1. Now we are up to 35th episode. So these are the basic pillars. Okay, basics. They're not advanced level. Going further, we will see advanced level also. So these all are very important. Please don't neglect these episodes. If you don't watch it, watch again and watch twice. No problem, not an issue. Uh, Everything is in the YouTube. You can have it in the usually chief admins are posting the same thing in the Telegram group, main Telegram group, wherein they are posting from episode to 1 to episode 45. So if you are unable to understand anything or if you want to recollect anything, you can see direct videos from which is uh, done by our father Salim Joseph. So you can uh, have a conclusion. You can have any doubts. You can keep a side, write it on the written on download, and you can ask in the sessions. Okay.
Good
Hope
evening
I'm
to all.
clear. Good evening, Prabhavati ma'am. Please change your device name, ma'am. I have requested yesterday as well, but you couldn't change your device name. Please try to change your device name.
I tried, okay, but I couldn't change. I don't know what's wrong. I tried, okay. I'll do again today.
Hmm. It's simple, ma'am. Just if you go to your profile in Zoom, you can find your name. If you click on your name, profile will appear, and you can change the name. That's a very simple thing.
Okay.
We'll wait. Only how many participants are there? Only 12, 10 members only are joined. If somebody want coordination, Bharati ma'am. Okay, Ranjini, we'll go ahead.
Yes, Ganesh.
We'll go ahead with the presentation.
Yeah, Ganesh. Hello, Ganesh.
Hi, Cindy.
Okay, we will start now.
You start sharing. Bharti, please be ready. Madhusri and Jency George. Please mute everyone except who are going to speak, except them. Everyone, please mute.
Ganesh, we will start now.
Yes, yes, ma'am.
Good evening, all. I am Ranjini, one of the OET aspirants from Edu Skills International. I would like to invite Bharati for today coordination. Bharati, welcome.
Thank you, ma'am. Good evening, all. I am one of the OET aspirant from EduSkills family. Before starting our discussion, we will do 1 minute prayer. Good evening, and thank you to Father. He's very supporting us to do this discussion. I am very thankful to our admin panel also. 1 or 2, 3 days we are discussing about name-based questions, how you can track according to the Father's strategies. First of all, I would like to welcome our Madhusri. Kindly come forward and do your presentation. First question, please.
Thank you, Bharti ma'am. Good evening to all. I am Madhushri, one of the OET aspirant from EduSkills. So today we are going to see about the episode 35. The question number is 10. Please. So it's a continuation of the name-based questions. So today also we are going to see one of the name-based questions. So how to find the answer based on the name. So the question number 10, according to the writer, why were early portable AACs problematic for those not in wheelchairs? So this is the question. So we have to highlight the questions 10. It's like keywords in the questions. So as we see, there is a abbreviation. So as a name based, so even the abbreviations will be counting it. So we are going to highlight abbreviations and the reason, like why it is mentioned here. So why we have to see the reason. So based on what's the reason for using the portable device. So, and also there is one more word, that is those not in wheelchair, not. So these are the keywords we are going to mention, like highlight it. So always whenever we see the questions, we have to highlight the keywords first. So we'll see the next slide. So why and the AACs. A is an abbreviation. So as soon as we are highlighting the question, in the questions, what are the keywords? So we have to go on to the text. So in the text, we have found the key like abbreviation in the last 4th line of it. So there is a AAC. So we are going to highlight it, and based on after that, we are going to find the keywords in the answer options. So in the answer options, we have a keywords like first option, it is A option. They were heavy and bulky. So heavy and bulky are the keywords. So like it indicates the how the device is. So the device is very weightful, and they were remarkably fragile. So fragile means it will be like a brokeable. So fragile is the keyword, and they could not be used while walking. So this device, when while walking, it cannot be used as it is in wheelchair. So to sit and move, so it is useful. They needed access to a power source. So here the like access to the power source is the keyword. So next we'll have a next slide, please. So after finding out all the keywords, so we'll go on to the text to find is there any similar kind of words which is related to the options. So we have abbreviations like AAC. So we'll just look forward into the next to that abbreviations. What is there? So here it is. Although they were advertised as portable, these devices often weighed a FT 15 to 20 pounds and tended to range from 20 to 25 inches in size. So here they are mentioning about the size, that the weight and the size of the device. So in the first option, we have a heavy and bulky. So that is synonym, like correlating each other. So by through this, we can identify the question, like answer for the questions. And they have not mentioned anywhere it is like whether the device is fragile or whether it can be used while walking. So nowhere the other options have been mentioned. So directly we can move on to the, like we can confirm that the answer is the option A. They were heavy and bulky. The next slide. So that shows. So whenever there is a name as well as the abbreviations, directly we can swoop into the abbreviations and the names. So next to that name as well as the abbreviation, we can find the answer. So thank you so much for this strategies and the opportunities provided by the EduSkill for me. Thank you so much, ma'am.
Thank you, Madhusri ma'am. You well explained how to find the stem word means hedging words in the question option and questions and answer options, and name based questions you went through according to the father's strategy. You went to the sweep to the name and you read the line, and you how you came you got the answer. It's good. She well explained. One more strategy also you can apply this. Anyone can explain, please? Anyone can get this one more further strategy?
Yeah, conjunction and
Conjunction.
in the answer option, heavy and
Then
bulky.
Heavy and bulky, and other one is fragile. Fragile is light and breakable. That is heavy. So opposite to opposite other two we can eliminate, and we can come through that paragraph is saying although they were advised as portable, this device often weighted FFT 15 to 20 pounds and tended to range from 20 to 25 inch in size. It is heavy. So we can go through answer A option. I think you all understand. Now I am welcome our next participant, Mrs. Jinsi Varkis. Please come forward. Kindly explain number the 13 question, please.
Okay, thank you, Bharati ma'am. Let me introduce myself. I'm Jinsi George, one of the OET aspirant in EduSkills family. Then I'm really thankful to Father Salim Joseph and the admin panel to providing a wonderful opportunity. Could you please move the slide? Yeah, I'm going to deal with the 13. The question is name-based question. And it's mentioned here, let me read the question. The National Health and Medical Research Council guidelines suggest. It's kind of name-based question. And okay, those who are in beginners, they have to go through the all passage, the beginning. So if advanced people means those who are competent with the reading, they have to go to the name is mentioned in the paragraph. Then there is other kind of strategy we are applying this question. And do you know anyone that which strategy we are applying this question? So let me explain.
Name-based.
the name based
Yeah.
question.
Name-based.
Yeah, it's name based question, and we are applying for it's a kind of opinion, like that is suggestion, and there is already name that is NHMRC. Then other one it's a contract based question also, and it's mentioned there is scale as well. It's can mention in the scale also in the question, the answer option. Let me read the answer first. The option A, drinking more than 2 standard drink a day. And the hedging word there is a more than. The second option is drinking 100 ml of wine or 285 ml of beer a day. That also that there is a scale mentioned. And the third option is drinking at least 2 standard drink a day. At least that the scale. The fourth option is drinking 2 standard drink a day or less. As already I was in the strategy, father mentioned there is a scale like more than 2, at least 2, then 2, and the last one is standard drinks like 100 ml of wine and 285 ml of beer. That is the scale we are using, like boiling water. The next, I think everyone knows about that one. And then those who are competent, immediately we can go through the name in the text. Here already mentioned after the contrast word, however, it's already mentioned given that the risk increase in the amount. Sorry. Yeah. However, given that the could you please move the slide? Yeah, however, given that the risk increase with the amount, the Cancer Council suggests that anyone who wants to drink should stick into the National Health and Medical Research Council guideline. It's already mentioned National Health and Medical Research Council. Immediately we can go through that text onwards. Then it's mentioned here no more than 2 standard drink in a day for healthy men and women. Then when we are going to the answer option, the answer is drinking 2 standard drink a day or less. That is the paraphrasing of the no more than 2 standard drink. No more than 2 standard drink means maximum we can drink it 2 only, 2 or less. That is the paraphrasing of no more than. And the how we are eliminating the other option, the drinking at least 2 standard drink a day, which means at least 2 standard drink, minimum 2 standard drink, or can drink more than 2 standard more than 2 drinks. The B option, then we can eliminate that one. Then B option, drinking 100 ml of wine or 285 ml of beer in a day. In the text is mentioned a standard drink is usually described as the equivalent of 100 ml of wine or 285 ml of beer. So that's why we are because that is the least one, so we have to eliminate that one. So answer option A is drinking more than 2 standard drinks in a day. The test is not mentioned about more than 2 standard drinks, so that's why this A, B and C we eliminated. Then D option is the right one. I hope everyone understand what I am saying. So if you have any doubt or anything, immediately you can ask me. Thank you.
Thank you, Jinsi ma'am. You nicely you explained how to tackle the name-based question, and you explain also scale expression and contrast word. However, and you mentioned how to find out the answer from the test, and you explained very well how what is the option, how you removed A, B, and C, and how you got the answer D. It's good, very good. Thank you very much. I am very thankful to everyone. Anyone have doubts, please you can ask now.
Thank you, Bharati, for your today's coordination. Then I will share one more strategy in the first episode. Ganesh, please show the Madhusri slide. So in our further strategy, we can see a contrast word. The answer is coming after the contrast word. So although they are advertised as a portable, the device often weighted a hefty 15 to 20 pounds and tend to range from 20 to 25 inches in size. This is an independent clause. So this is a complex sentence. In the complex sentence, the answer is coming from the independent clause. The independent clause is a sentence coming after the comma. So in this sentence, in this paragraph, the independent clause is these devices often weighted a hefty 15 to 20 pounds and tend to range from 20 to 20 inches in size. So the first one is an answer. Okay. Hello, Ganesh.
Yes, Rajni.
Now,
Anyone have any doubt?
Oh, yes. I just want to know this one, no? Dependent and independent clause. So, can you explain again? I'm having little doubt here.
yeah, independent clause means they stand itself.
Oh, okay.
Okay. So although is a contrast word. So
Mm-hmm.
the before comma is the dependent clause, and the after comma, after comma the sentence. These device often waited. This is an independent clause. The most of the and in a complex sentence, most of the answer is coming from the independent clause. Okay, are you getting my point?
Yes, yes. I got it. Thank you, thank you.
Okay, Prasad.
I think we can give it to Father. Rajni?
Yes, Ganesh. Hello.
Once talk to Father.
Hello, Father. Good evening, Father. If you have any doubts, please discuss.
Rajni?
Ganesh, Father is not there.
Not answering caller. Calling once.
Okay.
Ma'am, hello.
Yes,
Yes,
Vandika.
Vantika, you can talk.
Okay, ma'am. Just now you said the dependent clause. Before comma, you said that is dependent, right? And after comma, it will be independent, right?
Yeah, okay. Yes, Vandika.
Am I audible, ma'am?
Yes, Vandika. The after the comma independent clause.
Okay, okay, okay. Okay, okay, ma'am. Thank you so much.
Good evening, Father.
Good evening.
Good evening, Father.
Very good evening. I today very small number of participants
Evening,
outside
Father.
of OET. Good evening. Good evening. Hmm.
Maybe duty, Father. That's why. Otherwise, everyone will good.
Mm-hmm. So we'll not have a session today. Only very few are there. But we will hardly some people. Yeah, keep the chat rate. Let's see if it improves. Yeah. So do we still have paragraphs? This one name tip again. Next episodes. Any idea? What is next episode for tomorrow?
Further, this is a reading part A, introduction.
Tomorrow.
Yeah, Father.
Yeah. Yeah, please click the like button and you need to subscribe the channel to message. Thank you for the super chats. All the counts are super chats. You can see different colors in the super chats. 1, 2, 3 numbers. Yes. Yeah, there is a tendency to join after the discussion. That's not at all good. Okay. Bharat Isubin, thank you for the super chat. Yes. And that's not a good attitude. Those who are at YouTube, listen to me. If you are really wanting to succeed in OET, you need to follow the instructions. Those who join after discussion clearly shows they are not doing their task. They aren't following the instructions. They are just coming to attend the sessions. That itself doesn't guarantee success. There is some instrument disturbing. Is it my Regina, please mute. Regina. Okay. Regina, please mute. Can you hear me? Otherwise, hello.
Father.
Yes. Yeah. When you are not, yeah. Those who are not on the video, if you are in the Zoom classroom, you are supposed to unmute the video. Don't make me to repeat it every day. Tomorrow onwards, we will just remove you, whoever you are. Okay. Yeah. Everybody is supposed to keep the basic rule of the Zoom classroom, Puja, Ganesh, everyone. Yes. Yeah. Puja, are you listening to me? You keep this tendency, we will permanently remove you, okay? Because you should know when you have entered here, we suppose you know, right? Don't admit, okay? I will admit whomever is required.
Okay.
Ganesh, Vantika, please unmute. Hello. Ganesh, are you listening to me?
Father.
Yes, Father.
You being the admin, you are supposed to unmute and show model to others. Okay.
Yes, Father. But I am just watching YouTube live, Father. Actually, just making super chat.
Who is admitting? Please don't admit anyone. I will admit whomever I need to be admitted. Okay. Those who are not
Okay.
responding, none of you need to admit anyone. Okay.
Yes, Father.
Okay, Father.
And I told you, then again you admitted. Pooja and all, they are not responding at all. Yes. Nadala, thank you for the super chat. Yes. Yes, Mr. Everest, Mrs. Everest, thank you. Thank you for the super chat. Yes. Let us celebrate. Yes.
Father, I want to ask one thing.
Yeah.
What is this membership, Father?
Membership, if you go to your YouTube,
YouTube.
you'll find there is like super chat, you'll find membership. I myself, I'm not sure. You can ask Lini Varghese probably, because that is the tech team. They do it to maintain, no? Those who have got it, Lini Varghese or
Okay.
Chandravardhani can explain. Chandravardhani is not here. Lini can explain where to find
Yeah.
it.
When you go to the YouTube, you can see an option join. At the left side, you
Okay.
can see join. Yeah. When you go to the YouTube, you can see left side. Okay. Left side of the EduSkill emblem, you can see join.
Join. Yes, yes.
Yeah. You
Join.
click that, it will follow you. It will guide you once you click that.
What is the specialty? What is the difference
I think
between normal?
Ganesh, do you have disturbance at the background?
Yes, Father. Small.
If you have distractions, please don't interact. A lot of sounds. It irritates everyone, you know. This is a registration that Liniva gets that's done for 799. That's also a way of supporting the platform. And also they have preferential consideration in everything. And you can see the green name and a star in front of their name. And their message is highlighted. Yes. Ganesh, thank you for the super chat. Yes. Bharati, thank you for the super chat. Yes. Everybody can try. It starts with 10 rupees. It's not the money, but it helps to reach more people. Anything from today's discussion? Any doubts remaining? Before we
Father,
begin? Come on.
today one answer is coming from the complex sentence. So could you please explain once more?
Complex sentence with the two clauses. Clauses means, say, simple sentence means subject, verb will do. She plays. She sleeps. It can be subject, verb, object. She likes sweets. She subject, likes verb, and sweets, object. When you combine two simple sentences, one simple sentence is known as an independent clause, earlier USE. A simple sentence is known as a independent clause. It's an independent clause. It must stand by itself, means it has got meaning. She likes sweets. It has meaning. Okay. So when you combine them with a conjunction, she likes sweets, but she is diabetes. She likes sweets, but she is diabetes. She is diabetes is a full sentence. She likes sweets is a full sentence. Two independent clauses connected with a conjunction is compound sentence. Compound sentence. Regina, if you'll have to keep your phone somewhere, okay? Don't hold the phone. That's the basic rule here. It irritates, you know, screen gives or keeps on moving. Okay. Then complex sentence means one independent clause and another dependent clause. Dependent clause means it depends on another clause for the full meaning. Without another sentence, that will not have full meaning. For example, if she is consistent in her practice, she will succeed in OET. If she is consistent in her practice, is a dependent clause. It's not full in its meaning. If she is consistent in her practice, no full meaning. Or if she is sick, she will be admitted to the hospital. If she is sick, comma, she will be admitted to the hospital. She will be admitted to the hospital is an independent clause. It has full meaning in itself. Whereas if she is sick, that has no full meaning. So after the dependent clause, there will be a comma if the sentence begins with the dependent clause. If the sentence begins with the independent clause, there is no comma. For example, she will be admitted to the hospital if she is sick. There is no comma after dependent clause. It can be written either way. You can write independent clause first or dependent clause. Okay. So normally, generally, the main idea is in the independent clause. Though she is sick, she attended the duty today. Being sick is not the main message. She was present for the duty today is the main message. So generally, there could be some exceptions, but generally all our rules or strategies are there. Exceptions are always possible. That's why we call them rules. Every rule has exceptions. So generally, 90+% or 95%, even 99%, the answer will come from the independent clause. Answer will be there in the independent clause. You can slide over dependent clause. You can concentrate on independent clause.
Independent clause.
Yeah, in the opinion questions, their opinion will be in the independent clause, not in the dependent clause. Though the boy is well settled and handsome, I decided not to proceed with the proposal. What is the message? I decided not to proceed with the proposal is the message. Though the boy is well settled and handsome, that is not the message. Message is I stopped the proposal, proceedings in the regarding that particular proposal. Is that clear?
Yes, Father.
Yeah. Anything
Yes,
else?
for that.
Anything else?
No.
Yeah, anyhow, thank you. The discussion is going good. Ganesh, Ranjini, Elizabeth, who else? One more?
Lini sister.
Lini sister, yeah. So these are the
Sini
four
sister.
admins. Yeah, Sini sister. These are the four admins who are in charge of the discussion. Independent process joined pan boys is compound sentence. She likes sweets, but she is diabetic. Okay, good. Yes. So that's it. Shall we go on?
Yes, Father.
Yes, Father.
And regarding name, that is the end of it today, right?
I think.
Yes, Father.
Okay, let's see. So I'll have to just show you a couple of examples, then we'll go for a small listening practice probably. Yes. So once again, good evening and welcome to EduSkills OET Medici. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. And this is an absolutely free platform. This platform is of the health professionals by the health professionals and for the health professionals. Shall we just hit the chat button? It is just 3. So the members have gone down from 30 to 20. Just everyone at YouTube as well. Just send some messages in the chat box, in the comment space. Yeah, yes, it's just 3, just 4. Yeah, as you hit the chat box, I will find out something for you, which was not in my plan, but still I think I must do it. Since you are going to end with the name strategy, yes. Am I visible and audible at YouTube? Yes. Okay, let me share my screen. Since we are completing that name strategy, we have plenty of questions. We'll just recall something which was not in my plan. Still, I think we must get into it. There is some instrument at your Zoom classroom creating disturbance. Okay, thank you. Please, further, is this an example of complex sentence? Mr. Ganesh is saying in the daily discussion, many participants are not doing their tasks. Mr. Severest, that is not an example of complex sentence. Mr. Ganesh is trying in the daily discussion. That is a sentence, full sentence. Though Mr. Ganesh is trying his level best, many participants are not doing their tasks. Okay. Because the dependent clause always begins with a conditional thing. Like, although Ganesh is trying his level best to improve the participation in daily discussion, many participants are not doing their tasks. That could be a complex sentence. Somebody has commented something in the YouTube, Ganesh. That's why I'm explaining to them. Don't worry. Okay. They have given a complex sentence with your name. Yes, in the YouTube comment space. In the YouTube, it is in focus mode, right? Only I am seeing there, right?
Yes, Father.
Okay. Now, this was not in my schedule, but then I'll just give you an idea how important the name is. Basic things we have seen. You can see the screen.
Yes, Father.
Yeah. Basic things we have seen. And just to recollect, then I'll show you some examples. I don't know which all you tackled these days. I don't remember. So scan for capital letters, look for capital letters. Names are easy to spot because they start with capital letters. Names of people means individuals, designation, organization, countries, studies, illness, treatment or drugs, organ or body part, device, a test. Okay. Now, I'm not sure which all examples we have seen. We are not explaining these things. You know them. Now you see. See, look for designation profession. We are not going to explain it, okay? A molecular genetist. That is the designation. So that also indicates there is a name in the text. Dr. Janvik. That is last but fourth line, right? So Boston. That also can be an indication where the answer is. So this is designation. Look for designation. Okay. So you know the name is here. A molecular genetist. That we have seen. We are not going to that. just show you different examples, just to show you there are so many questions with the different examples. Now you see in the same question, you have designation again. Look for designation, neurologist. So neurologist is here, Dr. Alan Roses. Immediately you can go to that. We have seen that. Okay. Again, one sec. We will not look into listening. Yeah. Oh, sorry. Then look for studies reports. Okay. See, 2 reports mentioned. So there will be 2 reports or 2 organizations mentioned. 2 reports. That shows immediately you have to go to those reports. So then look for people again, the name of some individual. Here you have Professor Broom. So immediately you go to Professor Broom. Then again, name of people, look for names of people. You have names of Joanna Ashmore Sweeves. Joanna Ashmore is here. Immediately go there. Then you have the answer. Then look for treatment or drugs. Okay. Now you see here you have a drug, name of a drug. Immediately you can go to the name of a drug and find the answer. Look for organizations, names of organization. As we have seen today, I think National Health and Medical Research Council name is there. So immediately go to that particular name. Okay. Yes. Then again, look for people. See Dr. Longo Fields. Dr. Longo Fields. Then again, look for names of people. Dr. Saul Objects. Dr. Saul disagrees. You go to that name. Again, look for people. Dr. Soto suggests all this from official authentic materials. Okay. Then again, name of the people, a human being like Dr. Professor Steve Cole. Professor Steve Cole, name is there. Then immediately go to the name. Then again, countries, names of the countries. If you have names of the countries, look for it. You have Australia, United States is given, other countries are given, but we are only bothered about Australia. Go to Australia. Okay, again, name of some person, that is Dustin Tyler. Okay, again, name of a person, Bergen. Who does or Bergen and it says. So you have to go to Bergen in the text. Again, psychologist Molly Crossman. So you have designation and name. Okay. Then in the sleep deprivation, you have Evan Quarters. Evan Quarters. They're not explaining, just to tell you, so many questions are based on this name. That is cool. Got an idea? Just some
Yes,
examples
Father.
for different types of names. Okay. So
Thank
locate the
you,
names.
Father.
Yeah, there
Thank
are many
you.
more. There are many more. This is what I had collected some. I don't know which all things were there in the episode, but still we thought give you an idea. Anything? Because we are ending with this particular tip. Even if it happens during some of the tests again, we will not be explaining it. We will be skipping over, okay? Because we have selected most of them from those materials. The particular questions with name tip or name strategy. Any concerns about it before we go to next practice? Ganesh, no smile. Yeah, Ganesh is exhausted today. Yes.
No exhaustion, Father.
Okay. At YouTube comment space, do you have some energy? Otherwise, we will not go for session today. Because it's listening, you need some energy. Unless you have good energy, you will not be able to go on. Get some snacks in 1 minute, some juice, some tea. I am having my tea. Yeah.
Late night tea.
Yes. Please Have something so that you have energy. Today everybody seem to be dull. Why is that?
No, Father.
Except Varsha. Only Varsha is smiling. Okay. Hmm. You're waiting 1 minute. Let's see. Other people to grab something. Yes. Others can, those who already have something, you can hit the chat box, comment space. Yeah. And you can also go for a super chat if you love our mission. It starts from ₹10. Yes. Yes. Father, I am out of room. Let me be in room if possible. Is it? I can make out. Is it?
Anu Malani.
Okay. I can read. Please, Father, is this okay? That is done. If you have any special concerns, you can message. A compound sentence is linked with a conjunction, right, Father? Salafa, a conjunction, no. Conjunction is like, and there is a compound sentence. A compound sentence is connected with a conjunction. Okay. Complex sentence always is with minimum one dependent clause. Okay. There can be more than one dependent clause, minimum one dependent clause and one independent clause. So, like, although we are hectically scheduled, we want to attend OET sessions. So, although we are hectically scheduled is the dependent clause. Okay. We are interested to attend OET sessions is the independent clause. So, conjunction, you can have conjunctions. If you use conjunction, need not be complex sentence. I think if you can just go to writing grammar, or in the writing, I have taught a couple of steps. Let me check if I can show you. Complex sentence. Okay, it's not compound sentence. I'll just post in the writing. I have given example, small 2-3 minutes videos. I'm just posting it at Telegram, okay? Main Telegram group. Paste. See, I have posted it in the main Telegram group. Example about simple, compound, complex, how to make it, all those things. Let me check if I can. Writing grammar. Right. Yes, writing grammar. I think this must have one more. I am posting at the. You can save these links. Writing grammar, that also explains simple, compound, and complex sentences, I believe. Yes. Writing grammar step by step. Where I have explained exactly what is a simple sentence, what is a compound sentence, complex sentence, all those details. Although exam is difficult, many students pass the exam. Yes. Chandravadini, that is exactly a complex sentence. Although exam is difficult, many students pass the exam. Yes, that is complex sentence. Any other? Yes, Father, got it. Thank you so much. Yes. Father for sharing name strategy questions. Yes. Yes. Okay then. We will go with, yeah. Now you see, this is Aaron Fitzpatrick, the listening part A. You see here it is medical history. Then you have baby's father, family history, points raised. Here symptoms, background details, then medical history, next steps. You see the similarity. Here points raised, here next steps. Medical history, it is given in the second point, but today's it is given at the last. Medical history. These are the side headings, okay? Today's questions are like this. See? Aaron Fitzpatrick, symptoms, background details, medical history, next steps. What are the questions? Could you start by telling me about what's been going on with your vision? So what do you understand? The main issue is somebody having a
Eye problem.
eye problem. Yes. Second question, ever had any vision problems before? Ever had any vision problems before?
Before.
Third one, in terms of your blurred vision, what do you think might work for you? Fourth one, let's do some tests to check out your eyes and go from there. If you see, even other day, what was the other one? Melissa Gordon, right? Melissa Gordon almost had the same questions. At the end, we had some example about tests, right? Do you remember? Some
Yes.
tests
Yes,
where some
Amino
test name was,
amino synthesis.
yeah, exactly. So there then the patient suggested something else, some other test, that was the answer. And vision problem before, you had a question similar to that. Do you remember something of that sort? If you have the note, you can have a look. Ever had any vision problems before? What was the question earlier? Those who have distractions, please don't unmute. Yes. Don't get angry. You have no right to get angry with the kids. Okay, they are having their time. Okay, you can mute. That's all. Yes, it's family time. Yeah, come on. Do you have the notes and right? Just you can look back. First one was background, right? Previously it was like, let's speak something about your background. Okay. Then medical history. Then earlier first pregnancy. You remember? Former pregnancy. Did you have some issues with the previous pregnancy? Here also ever had any vision problems before? Okay. What do you think might work for you? Almost similar nature of questions will appear. And here earlier you had around 10 questions. Here you have only 4 questions. So more of the answers will come from patient's mouths, and you'll have to concentrate on that. Okay. Let's just yeah.
Father, what do we write here? 1, 2, 3, or these questions?
These are not questions. These are the questions from the audio.
Mm-hmm.
Okay.
Mm-hmm.
These are the questions.
Yes,
Now
Father.
you can just, we will not look into now. We have Aiden Fishback. See, symptoms. Side heading is symptoms. What does it mean?
Symptoms.
You have to look for answers will be symptoms.
Symptoms. Yes, Father.
Okay. Some symptoms will be the answers. So you have to see describes his vision as. Even previously, the previous example you had something like that. Described, also known as. Also known as. Then needs increasingly dash to read in evenings. Needs something. When you are having vision problem, you need something more, something you'll be looking like this. Okay. When power fails, so to YouTube, I could not read properly. So what do you require when you don't have a good eyesight?
Power.
Eyesight, lens,
More light.
increase.
More
Lens
light
power
is it?
or
Yeah,
light.
more light may be required because you can't see. You need perfect light. Then found he was having to hold. Okay, purchase glasses from.
Place.
Yeah, purchase
Shop,
glasses from
pharmacy.
somewhere. Often finds that
From
he is. Look for the words before and after. He is dash his eyes. Doing something with his eyes. Okay, when struggling to see, can also experience something. When struggling to see, you experience something else. What do you experience? And then treats pain with treats. What is the treatment? Which is known as fast acting something. Some medication. Now background details. These side headings are very, very important. Okay. Background details. Possibly. Brother also wears glasses. Okay. Possibly dash. Medical history. The previous one, it was the second side heading, medical history. Recently suffered from. Okay. What was your medical history? Treated with antibiotics still. Still experiencing symptoms of dash. Treated with antibiotics, but still experiencing symptoms of something. Lost excess weight following. Yeah, lost weight following something. Okay. Describes it as a wake-up call. Okay. Next steps. Isn't willing to wear something. Is not willing to wear lens, specs, something, right? Then you have eye problems. Must be given something to correct his eyes. Never had one. Okay. Shall we listen to?
Yes, sir.
Yeah. You can just write down 1 to 12 numbers in the notes so that you can fill in.
Completed for the
Then
Yes, Father.
all may not be as fast as Benjamin. So give them little more time. At the YouTube comment space, if you have done with, just say ready.
Ready, Father.
Yes, Salafa, exactly. A condition. If somebody wants to join here, Salafa, do you want to come to the Zoom classroom? I've given you the link, I believe. The same link you can use which I give you. Yes, Father. Yes, Father. Ready. Yes. Now listen, okay? Sorry, I'll have to share again. Our sound is not enhanced. Give me 1 sec. Yes. Now it is cool.
You hear an optometrist talking to a patient called Aidan Fitzpatrick who has been experiencing blurred vision?
You are audible, right?
Yes, sir.
No,
No, Father, no voice now.
No, that was.
No, it will come. It will come. It will come. Few seconds.
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly. After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago, I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere, not at home. I've actually never had an eye test, so I should probably schedule one of those as a next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
Yeah, Ganesh has some distractions, I believe. Did you get the answers? Do you have background sounds? Please don't unmute, okay?
Father, the voice is very low for me, so I couldn't hear I couldn't hear, I feel like whole. Only four things I found.
That control is in your hand, Ma. Sound is with your earphone or your instrument.
Father, I can hear you.
Yeah, even the other one, you have to raise the sound. Yeah, you have to raise the sound, Ma.
I already, Father.
Yeah, that's the maximum sound the audio can be played. Okay, So you have to raise the sound. Others could hear?
It was fine,
Yes,
Father.
Father, yes, you can hear it nicely.
Yeah, only you have to increase the voice, ma.
Maybe
That's in your instrument. Otherwise, if you can courier your phone, I can increase and send it back. The sound volume. Okay, cool. That's fine. That's fine. You will gradually you will understand how to do it. Okay. Next time I'll play with more sound here, but then it will be irritating others. Let's try for Melanie, right? Yes. What is the first answer? Did you get it?
Yes,
fussy.
Father.
Fussy.
Fussy,
Business
yes.
fussy around the edges.
Fussy, yes. You are right. You can listen next time again. Fussy it is. Yeah, next one.
More light. Father, more light.
More light, yes. Yeah. Third one, purchase glasses from
Pharmacy.
Pharmacy.
pharmacy. And normally you don't purchase glasses from grocery shop, right? So it is yeah, normally you purchase, yeah. Often finds that he is dash in eyes.
Blood.
Squinting.
Okay, that's it now. You can listen again carefully when it comes next time. When struggling to see can also experience
Headache.
Oh.
Aiden treats pain with
Ibuprofen.
Ibuprofen.
okay. And background details. Brother also wears glasses, possibly.
Short-sighted.
Short-sighted.
Medical history. Recently suffered from
Sinusitis.
experiencing symptoms of
Cold.
lost excess weight following a
Myocardial infarction.
myocardial infarction. Yes, exactly. Isn't willing to wear
Contact lenses.
Contact lenses.
contact lenses. Must be given
Had an eye test.
Eye
Eye
test.
test.
Okay.
The
Listen
last one. Okay.
Listen one more time so that you have clarity, focusing on those answer words or the synonyms used. If you can write down some of the synonyms. Okay, everybody mute, okay, when I'm playing this, so that there are no distraction. Last time I had to mute somebody. Yes.
You hear an optometrist talking to a patient called Aidan Fitzpatrick, who has been experiencing blurred vision.
Father, please increase the voice.
Can others hear voice?
Yeah, we
Yes,
can
Father.
It is pretty good sound, Father, actually.
This is highest mark, which is not advised by the device manager. It's above the device manager advice. I've come to maximum. You increase the voice in your instrument, okay? Yes. Now you can look at those words, gaps, words before and after. That's why the time is given.
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago. And I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly. After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them, and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere and not at home. I've actually never had an eye test, so I should probably schedule one of those as the next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
Pause it. Clear?
Yes, Father.
Yeah. What is the next step? Next step?
Next step with script.
Script, Father.
Yeah, you have to listen with the script. Okay. One second, just to share the script. No, I will share it again. 1 second. Okay.
Father, I missed number 7 answer.
Okay, you can find it now when you are reading with the script. Okay. Can you see the script?
Yes, Father.
Yes, Father.
We are playing it again. You can now. Let me see. You will have to increase the size. Is that cool?
Yes, sir.
Readable?
Yes, sir.
Yeah, yes, Father.
Okay. So we will be playing the script audio as well as reading the script. Okay. And write down whatever is important or any synonyms and verify whether your answer was right. And that's the best practice for getting the accents of different natives. Okay. Shall we go?
Yes.
With a smile. Yes. Ganesh, now smile.
You hear an optometrist talking to a patient called Aiden Fitzpatrick, who has been experiencing blurred vision.
Those of you cannot see, you can zoom the screen, okay? Touch the screen with 2 fingers of your phone, then you can zoom it. If you are holding it vertical, make it horizontal. Follow the script, okay? Along with the audio and try to
Hi,
write something.
Aiden. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly. After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read. I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them, and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere, not at home. I've actually never had an eye test, so I should probably schedule one of those as a next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
You hear a senior obstetrician talking to a patient called Hillary.
Got it?
Yes, Father.
You want to verify your answer? Here it is. I'll share the answers. Check if we had some mistake. Fuzzy, more light, the pharmacy or pharmacy, both are right. Squinting, a pretty persistent headache or just headache, both the options are right. Ibuprofen, short-sighted, sinusitis, cold or cold, myocardial infarction. Even if you write MI, it's cool, but then since the audio says myocardial infarction, write full one. If you are not sure about the spellings, you can try MI, the abbreviation. Contact lenses and eye test. Cool, right?
Yes. Yes, sir.
Listen repeatedly and it becomes very cool. Now, if you had some difficulties, now again you have to listen and write down all the possible synonyms. Shall we try one more time?
Yes, sir.
For the synonyms?
Yes, sir.
We'll just see the this one. You can see the screen, right? then listen to it. And if you
Yes.
have any synonyms or synonymous expressions, just write down, okay?
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly. After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago, I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere and not at home. I've actually never had an eye test, so I should probably schedule one of those as the next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
Yes, you can also write down the side headings of different part A you do, right? So compare them together and find out how they present and what are the answers, all those things. And someone is asking if you write contact lens, headaches instead of lenses, headache, will you be penalized? You can't write headache instead of lenses, right? Headaches. Headaches. Do you use headaches? No, plural, right?
No, headache.
Yeah, headache. And instead of lenses, you can't use headache. And headache, you will be penalized. If you write contact lens. Okay, instead of contact lenses, if you write contact lens, will you be penalized? Most probably not. But then usually they are, since eyes, you don't say eye. Both the eyes need contact lens, right? So normally they are plural, used in plural, contact lenses. Even if you write contact lens, you may not be penalized.
Father, I have a doubt.
Yes.
So that disease condition, myocardial infarction, it should be in capital letter, no, M?
Need not be.
Okay,
It
then
can be small letter. MI, when you write abbreviation, you'll have to write MI.
Then ibuprofen also, I should be in.
Ibuprofen can be this one. Only brand names. That when we learn about writing, we will distinguish between brand names and generic names. Brand names and generic names. Okay, that we'll be dealing with it as a part of mistake. Ibuprofen you can write. It's a brand generic name.
Father, you explained about the abbreviation we can use for myocardial infarction. Like that, for other things also we can use myocardial means abbreviation.
Abbreviation accepted abbreviations, internationally accepted abbreviations can be used. Okay. But if you are sure about the full form, if it is given in the audio, we always suggest you write the full form.
Okay.
Like AIDS, you can write acquired immunodeficiency syndrome. If you are not able to complete within that time, you can write AIDS, AIDS. That's internationally accepted form. BP you can write, blood pressure.
Okay.
Okay.
Yes,
but then some local short forms you cannot write.
Okay.
If you use something in your hospital to make your conversation easy, you cannot use them. But the internationally accepted abbreviations can be used.
Okay. Thank you.
Yeah. Right.
Excuse me, Father.
Yes, please.
I think according to my opinion, she asked that ibuprofen, this one, why is small letter? I think like if the blank is starting first, then I think we have to start with capital letters.
Yeah, you can, definitely.
Then
if it is, that's what yesterday I explained. If it is proper noun, even if it comes at in between the line, you have to write saline, you have to write S capital. But even in the beginning or in between, that's what I explained yesterday. And ibuprofen, if you start the sentence, if it is starting with that word, you'll have to do it. But here, the thing is like what you are having here. This is like, this is not a sentence. It's all just a paraphrasing. So you can write from. When you write from, if it is a proper noun, you have to start with uppercase or capital letter. Otherwise, this is a in between the sentence, right? So you can write small letters. Yeah.
Small letters. Yeah.
Yes, exactly. That's what I stressed yesterday as well. And I told you, don't get too much stressed about those things. Yeah. And we will be very happy with 490 or 480. Don't worry. Enjoy the process. These all things before the exam, we will have a briefing for all of you after this batch program. There we will hit all the doubts and give you all the screens on doubts or the mistakes. Where you cannot have any mistakes is in writing subtest, because every bit of it is explained step by step. All the possible mistakes are explained. When I explained the address, I have explained, or writing the date, how to write the date. I have explained around 8 formats to write date, and 7 are, maybe some of them are right, not accepted. They are right, but not appreciated. Right means maybe when you write Indian, you write a type of date. Americans write a different type of dates. So there is something which is internationally right and appreciated. So I have given all those possibilities. So what all mistakes you can commit, I have explained all the 7 mistakes you can commit, even writing a date of the letter. And one thing correct. So you cannot make a mistake at all. Do you understand what I'm saying?
Yes, Father.
Yes, Father.
Now let me see if I can show you. One second. I'll just stop sharing this one and Don't take any tension. Now relax, okay? I'll show you how these things are explained. One thing, transformation. One sec. Yeah. One sec. Don't take any strain now. Be cool. Enjoy. That's all, okay? Don't take it as if something is serious. Can you see the screen?
Yes, Father.
See now, I have shown here how to write the name. This first one says write, second one appreciated. 19 January 2019, write and appreciated. That's the only way you can write in OET. 19th January 2019 with a comma here, it is right. There is nothing wrong, but it is not appreciated by OET. 19 Jan to 2019, neither right nor appreciated. 1901 2019 with these slashes, it is right to write, there is nothing wrong, but then it is not appreciated by OET. 19-1 to 2019, again right, but not appreciated. 01 19 2019, it is also right, but not appreciated by OET. 1 19 2019, not right, not even appreciated. January 19 2019, right, but not appreciated. So which is the right one? Which you have to write?
First one.
First one.
19 January.
First one. So I have given you all the possible mistakes. Out of them, out of 1, 2, 3, 4, 5, 6, 7, 8, 7 out of 8, 1, 2, 3, 4, 5, 6 are right. There is nothing wrong. But out of that 6, 5 are not appreciated by OET. You understand what I'm saying? Is there a possibility of making a mistake here?
No.
Father.
No, Father.
Yeah, this is how we have explained. It is an international exam because if you write the date first, month next, and year in third order, that will be British way of writing. Indians write that date, month, and year, but Americans write month, date, and year. So you don't know who is going to look into your letter. Have this model. This okay? That's, so a very good question. Yeah. This comma is optional. Is that clear? Now you see, I have given exactly all the sample letter models, how they have written, same way. The date is written the right way. That's a proof that you have. Do you sense what I'm saying? Hello?
Yes, Father.
Yes, Father.
Yeah, so what I'm saying, if you follow exactly the steps, no correction is required for your letter, at least to grade A+. Nobody need to correct. I have given more than 32 self-correction techniques where you can check your own letter where there is a mistake. Even address line, including a comma, I have explained all the possible ways where you can make a mistake, why that is a mistake. Thank you, Elizabeth, for the super chat. So why I showed this, because those things are clearly mentioned. And there's some offline session where people traveled from 300, 400 kilometers and stayed for 15 days with me and learned and passed OET. All of them are abroad. So they have spent a lot of money to listen to those sessions. They are available at your table, in your phone, or in your laptop. Whereas those people traveled and paid hostel fee and stayed and spent on food. Okay, I did not charge them anything, but then they had to spend a lot.
Yes, Father.
Anything else?
Whatever you
So
said.
what I say is take the instructions, go step by step. That's why I say patience is the key. And people keep on asking who will correct my letter. If you follow the 21 steps, definitely we will correct your letter. We need not correct your letter. Only if you are very sure you must get 500 out of 500, we need a correction. Otherwise, every bit of it is explained. You can definitely at the end, you can correct your own letter with 32 criteria. Yes. And particularly, I have made different volumes, like small videos about each part of the letter. Yes. Anything else you want to discuss? Anybody wanting to come to discuss directly? I'm just posting the Zoom classroom link over there in the comment space. With your comment space, you can join PI if at all you want to discuss anything face to face with me. And please participate in this one, okay? Otherwise, we will stop discussions. Because those admins are taking a lot of struggle, spending so much time again asking you to take slots. You see, all the active learners, if they take one slot, you will not get even in 1 month one slot. Okay, one student will not get. Earlier it was so. In one batch, I could see them fighting for the slots, saying that you got this week for 2 slots. I didn't get even 1 slot. So give me one chance. That should be the attitude. Before they post, every slot should be filled. Now, actually, you see those people, admins and all, don't require to take the slots because they have competency now. You must get the chance. You must use the opportunity. Because those people have gone through the whole process of discussions, all the subtests, like Ganesh and other people, 4 subtests. Yes. Any concerns? Elizabeth, good evening. Yes.
Good evening, sir.
How is your child?
It's better. Better now. Just now only sleep. Here, heavy rain. So I really missed the session today. I can
We are
join.
longing for some rain.
Yeah.
Send some this side.
Yeah.
It's very hot here. Can't sleep.
Oh my God. Yeah, it's very heavy rain. But they don't want to leave me, like both of them in my hands. So otherwise I will join at least without the light. But kids really scared because of the thunder.
No. Can watch it anytime.
Yeah,
It's the live is
of course,
yeah.
I need to watch. I just heard a bit, but I want to get the now. It's really treasure you are exposing.
And those full-timers, if they are really full-time learners, you can start with other tests also. Okay, no problem. Like basics of writing, practicing listening. That's why I mixed up little with the episodes, the listening as well, so that they can practice part A. Okay. Those who have time, not those who have little time, working and all that. Those people should go with patience only with the class. If you are full-time learner, if you have enough time, you can practice. Listening A is really cool. You write down all those side headings and compare. Almost everything is same. Once you are familiar with the sequence, you will understand better.
But problem
And
is the spelling mistake, Father. It's
spelling
really
mistakes. Now, spelling mistakes, okay, you had asked me some doubt on that, right? I don't know
yeah.
how to show you. Let me check if I can share the word format. There is a psychological technique to correct the spellings.
You see?
And sometimes accent also, sometimes they speak
Provide us further.
clearer. When they
That
speak, sometimes the accent and they are speaking the words we are not catching.
Yeah, accent. That's why I said you have to repeatedly watch some audios for a week or so. That is the 7th step. Then automatically you will get. Maybe every week you repeat one audio. Other things you can listen to, you can practice, but one you will continue. For example, this listening part A, you can continue for a week, repeatedly, passively listen when you work and all that. Then you get accent. Now tell me one possibility of spelling mistake. Now, what is the spelling of receive? R-C-E or I?
RCEIVE.
R-C?
R-E.
Okay.
CEIV.
Imagine some people make a mistake here. They start R-E-C-I-E-V. Okay? So how can you correct it? It's not by making writing impositions. Even if your kids are making a mistake, don't give them impositions. They will never improve. Okay? They will only improve. What you have to do here to make, if you confuse between E or I, you have to do this method. How? Only those letters write in big. Okay? On your paper, on your notebook, and keep it on the table, and in between sometimes look into it. That's cool. Within no time, your brain will correct your spelling and say E comes first, then I.
Let's try.
This,
try.
yeah, this is proven psychological method of spelling correction.
Write in the capital letter and put somewhere.
In the capital, or you can write small letters also, but then those two letters must be big.
Oh, okay.
Okay.
Only the correct one need to write.
Correct one. Don't never write the wrong one. Correct one. It doesn't mean it should be this one, but then uppercase shows more clarity, right? Whichever is appealing to you. It doesn't have a rule. But then those spellings where you make a mistake, highlight them in big letters, other spellings being small. On your notebook with a sketch pen, you can highlight and keep it there. Sometimes glance at it. Even without glancing, brain will automatically correct it.
Actually, I did our thing. Yes, Father. The 23 listening samples, I know almost all I wrote and the correct spelling. After a while, I repeat the spelling and write everything did. But after few days or sometimes later, I repeat the same listening. Definitely, I make the same mistake. That's my.
Were you able to see this one, my screen?
Yes.
Father.
Yes.
Okay. I thought I was not sharing. It was being shared, right?
Yeah, now it's shared. Yeah.
Yes.
Earlier you could not see, right?
No, I didn't see. Yeah.
Oh, you have to tell me, right? I was sharing and showing you. I said I am sharing the Microsoft Word document, and I'll show you. You can see this, right? When you asked me whether it should be in uppercase, I wrote in.
Oh, okay.
All letters. Receive.
Okay.
We will not forget the spelling.
Yeah, that's it. Instead of making children write 50 times imposition, which is a criminal thing, will never help them. You have to teach them this.
Okay.
Understood, right?
Yes, sir.
Not understood, Father.
No.
I didn't get, Father. Really, I didn't.
Somebody else, I will show the screen. Somebody else will explain now.
Okay,
Because
Father.
Ganesh doesn't like my explanation. Let me see. Somebody else will explain it. Whoever
Not
has
like
understood, whoever
I
has
did.
understood, please explain this.
Ganesh, I will tell
Elizabeth.
you. Okay, what I understand is if you have a spelling is wrong, if suppose you have a spelling mistake in receive, what you need to do is you need to identify the where is the wrong thing happened, then choose the correct letter and make it the where you make the mistake means you just choose the correct spelling and make it bigger that portion. If you write like RECIEV like that means you know that you make the mistakes in that portion. So you need to be put REC, then you can make the letter big and put
Okay.
it there, and then you can no, in between if you glance that page or if you put in your your fridge or your cupboard everywhere, you can just like a board, you can keep it there, then you just go through, just glance it, your brain will be feed automatically the correct spelling. The mistake portion you need to be
Yes.
make it bigger like this, like for the either the small letter or capital letter you can use it.
Got it.
Yeah. Okay, great. Thank God. Yeah, definitely will overcome this
Father?
spelling.
Excuse me, Father.
Yes, please.
Father, if we forget the name of medicine, mostly medicine, I'm not remembering. I forget the spelling. So this medicine is very difficult. When we read one like part C or maybe part A also, if there is a name of medicine, I'm writing in the paper, but after that there is another name. So different medicine cannot be remembered.
No, you have to, there is no other way. Like you have to keep on writing those names like paracetamol,
Yeah,
ibuprofen.
this is the common medicine, Father. This
Yeah,
one,
anything. Even if it is something, all the medicines are common, right? So
no,
even if it is
no,
not common,
there is
then
some
it is
complicated medicine.
the condition can be complicated. Medicine cannot be complicated.
Very
Okay,
difficult for the read.
that you have to just write down and learn. Here also you can use another logical thing. For example, you mistake whether E is first or I is first. Okay, so E comes first in the order, right? In the alphabetical order. Then comes I.
Yes,
In receive, you are seeing the screen, right?
yes.
Yes.
Yeah. See, E comes first, then I comes in the alphabet, right? Alphabetical order.
Yes.
So if you make a mistake, some people make RECIEV. So that's a wrong spelling. So understand E comes first. So write it first. I comes next. Write it next. A, B, C, D, E first. Then F, G, H, I. I comes in the ninth position. E comes in the fourth position in the order. That also logically you can understand. For example, I don't want to confuse the beginners and all that. When you come to write this one, we will understand when you have writing mode subtest. Okay. Now people will confuse between advice and advice. Okay. So which is the one you have to write in the letter? Which one?
ADVISA.
SC.
Now, if it is SE, I am not teaching it now. Okay. I don't want to confuse people. You have to highlight that SE. Okay. So that you are sure that fixes in your brain.
Okay.
Got it?
Yes.
So also you can use such logics in your medicine names of medicines as well. Always brain works on logics, not by hearting.
Yeah,
On
this question is,
relationships,
I find difficult name.
connections. Huh?
I use for hump.
Brain is
Hump
not
always
working
I
well.
wrote B, not B. Then in between I heard from my colleagues. Then hump definitely have the pain. So the spelling also HUMP, not B. Then I'm okay with the hump spelling.
Yeah.
Almost all hump have the pain. So I
Yes.
just fix in mind hump spelling is HUMP. Some kind of
Yes.
other thing is diary. Diary and dairy always confusing me. Then
Yes.
diary, DIARY, DI means I related to I myself. So if personal diary
Yes.
I wrote like that, I think.
Yeah. Recently, I had been to a school in Hunsur near Mysore for a program for the teachers, parents, and 10th standard students. So I asked the parents, if at all you want to ask the boy who is going to 10th standard to get some grocery as he comes back from the school. Okay, maybe dad is not there, only mom is there. So she asked the son who is in the 10th standard, what will you do normally? You have to get some items, grocery items. What will you do? You will tell them, come on, 1, 2, 3. You need garlic, 100 grams. You need jaggery. You need 2 kgs, and you need what else? Sugar, 1 kg. You will say 10 items. Will he be able to bring?
No, write in the paper.
Yeah, immediately. Even if there are 4 items, you will ask him, take a slip and write down now. You will forget. You will forget.
Yes, you will forget.
You will forget. Then, Tatasu, you saw that video? Did you
Yes,
see the
Acha.
Tatastu video? Yeah.
Yes.
Then all the goddesses will say Tatastu. And recently, last 2 months back at Mysore, in front of the parents, I called the students from 10th standard. Okay. And I made them to sit in front of the parents, facing them in the hall. And I told them, I prompted to them that you are going to remember whatever I say. And at a stretch, I told them for 30 concepts and asked them to repeat in the same order, 1 to 30. Individually, 2 of them. I asked the parents to select anybody, and they repeated. And all of them were to repeat, and I challenged them. They will not forget those 30 concepts even after 1 year. They will remember in the same order. And I told them, I challenge them, if they forget it, anyone from the 10th standard forgets these 30 concepts, I will stop teaching. You can record it, I said. Because I gave them confidence, you will not forget. But parents, from the very beginning, you will say, you cannot do it, you will forget, you will forget, you will forget. Let them forget one item. What happens? World will not end, right? One day, tea without sugar, it's cool. But you shouldn't kill their confidence. Right?
Oh, yeah.
When I was teaching, in one school, like there was a seminar, there was a demonstration in front of the press and more than 1,000 parents. One maths teacher stood up and said, Father, you cannot fool people. I am teaching maths for last 18 years and a government teacher. And you are literally fooling the public. No students can answer like this. Then I challenged them. You give them some note. I gave them 2 papers. I asked them, you write some 50 concepts, 50 names, no? Bench, eraser, pencil, computer, like that, whatever you want to write. Ask them to write 50. They got only 40, I think. Then I called them to the stage 2 teachers, and among the 30 students from 3rd, 4th, 5th standard students, I asked them, you can select anybody, 2 students, any 2 students. They selected 2 students. They came to the stage, read it once. Those 40 items, the list they read once, and in front of the teachers, in front of the public, more than 1,000 people, they repeated it 1 to 40, 40 to reverse, 40 to 1. And when they were asked what is 34, they repeated it. Let me check if I can find it somewhere here. Do you understand what I'm saying?
Yes, I can.
One sec, let me check if I can find here. Yes. Give me 1 minute. Trying to sleep for Indians. Are you there?
Yes, Father.
Yes, Father.
Yes, Father.
I'm just finding one small video. Let me see if it is there. I'll show you.
Oh, my Edu number is displaying in the screen.
In this room.
Yeah.
Yeah.
I'm so happy. The special batch I just posted today until 25 number only. Still few more slots are pending. I think.
Yeah, you can close it. Those who are interested. That means only so many are interested to be active.
Yeah.
Yeah.
Just wait for 2-3 days further. Maybe they didn't understand or something like that. Then we move to another batch.
Which
Is
one?
it okay? The
Which
Edu
one?
number,
Yeah.
choosing the number. Maybe they didn't get the importance of the Edu number or something like that. They keep silent. Maybe just wait for 2 or 3 days in special
Yeah.
batch to respond. Then we move to the next batch. Okay. Only few numbers is missing. Yeah,
How many have total numbers booked now?
almost 20. Let me see. I just give only 25. And now,
Yeah.
let me see.
Yeah, just I'll show you this one, okay?
Okay.
Yes. Same challenging. Can you see the screen?
Excuse me, Father.
Yeah.
But what concept you are telling this one? What I'm not understanding. What
Bharati,
the sequence they understand or what? How they
nothing.
understand 1 to 40?
Yeah, I'll show you. This one, just they were given the paper on the stage and asked to repeat it in the same order. 1 to 40 was written by those teachers. These teachers are sitting in the stage. These students are repeating it after reading once. It's not by hearting, fixing in their brain. Okay? Just see, you will understand. Hope you can see and hear. Sound is right? Visible, right?
Yes,
Yes,
visible.
yes.
Yeah.
Yes.
One sec. You can hear, right?
Yes, yes.
Yes,
Yes,
yes.
sir.
Yeah.
Yes.
There.
2 pen, 3 book, 4 watch, 5 diagram, 6 soha, 7 cap, 8 sheet, 9 chalk, 10 snake, 11 chair, 12.
Some problem with the player.
Yeah. How confident she is telling.
No, one more. I'll try some other player. This player is not working. ELC is not working. ELC. Some problem with the ELC. If I can play with another one. Open with Filmora. Hmm. It's working. When I'm sharing it, it's not working. Let me check. Is it visible?
Snake, 11 chair, 12 school, 13 phone, 3 book,
Audible?
4
In
watch,
focus,
5
in
diagram,
audio.
6 soha, 7 cap, 8 sheet, 9 chalk, 10 snake, 11 chair, 12 school, 13 phone, 14 LCD, 15 fan, 16 Nokia, 17 sound, 18 shoe, 19 shirt, 20 belt, 21 button, 22 eye, 23 nose, 24 teeth, 25 leg, 26 lips, 27 G, 28 bus, 29 scooter, 30 car, 31 tube, 32 chicken, 33 motor, 34 bread, 35 bed, 36 kadaba, 37 bat, 38 goat, 39 coat, 40 grapes.
All correct? Congratulations. We try from 40 to 1.
Now again 40 to 1.
40 grapes, 39 coat, 38 goat, 37 bat, 36 kadaba, 35 bed, 34 bread, 33 motor, 32 chicken, 31 tube, 30 car, 29 scooter, 28 bus, 27 jeep, 26 lips, 25 leg, 24 teeth, 23 nose, 22 eye, 21 button, 20 belt, 19 shirt, 18 shoe, 17 sound, 16 16 Nokia, 15
Now they will ask the number, they will say the name of the item. If they say the name of the item, they will say the number.
ವಸ್ತು ಹೇಳ್ಬೇಕು ಯಾವ್ದಾದ್ರು ನಂಬರ್ ಹೇಳಿ ಮೈಕಲ್ಲಿ 32 ಚಿಕನ್ 39 ಓಕೆ ಇನ್ನಿದು ಕೇಳಿ ವಸ್ತು ಹೇಳಿ ಯಾವ ನಂಬರ್ ಹೇಳಿ ವಸ್ತು ಯಾವ್ದಾದ್ರು ಹೇಳಿ ಅದಕ್ಕೆ ನಂಬರ್ ಅವರು ಹೇಳಿ
So if just the name, they will say the number. If they say the name, they will say that.
shoe
Yes. So it's possible, right? Those teachers, those are the best teachers, they have given in writing.
So usually the positive words.
You want to see them,
The
small kids competing with the calculator?
ಪ್ಲಸ್ ನಾನು ಹೇಳೋದಿಲ್ಲ ಪ್ಲಸ್ ನೀವು ಹಾಕೊಳ್ಬೇಕು ಲೆಸ್ ಅಂದ್ರೆ ಮೈನಸ್
Now this is those kids competing with the calculators. Can you see this?
Yeah.
Hello?
Yes.
Yes, I can see.
Is this visible video?
Yes, visible.
Yes, Father.
Yeah.
Teachers
I am
with
telling,
calculator.
I will not be saying plus because that will consume more time, right?
Plus 6, 9, that is 0, 9, 6, plus 5, 3, 0, 5, 3, 8, 2, less 3, that is 0, 8, 7, 4, less 6, 9, that is 0, 9, 6, plus 5, 3, 8, that is 0, 8, 5, 8, 1, less 9, that is 0, 7, 5, 7, 5, 5, that is 0, 7, 9, 9, 4, less 6, that is 0, 4, 9, 3, 8, 9, that is 0, 4, 7, 2, 9, less 2, that is 0, 9, 6, 4, 7, 9, that is 0, 4, 7, 2, 9, less 2, that is. Thank you. Position.
Father, let's teach our kids also. This is a prayer session.
Yes, yes. Mother, I think we teach this.
See, third standard student, now we will do one set.
Yeah. It's good for our children also, we can teach them.
I'll show you one. Small kids, how they do. One set. Here, one.
That is 0, 7, 9, 9, 4.
Visible, right?
Yes,
Yes, Father.
Yeah. Now you see this small child.
3, 8, 2, less 3. That is 0, 8, 7, 4, less 6, 9. That is 0, 9, 6, less 5, 3, 8. That is 0, 8, 5, 8, 1, less 9. That is 0, 7, 5, 7, 5, 5. That is 0, 7, 9, 9, 4, less 6. That is 0, 4, 7, 2, 9, less 2. That is 0, 9, 6, 4, 7, 9. That is 60472 less 2, that is? Correct. Congratulations. Thank you. Thank you.
Yes.
Father, he's using this one calculator or?
No, abacus, that's an instrument. In the initial stage they use, otherwise after that, after 3 months training, they don't use anything. They will do it in the mind.
Doing
That's
abacus.
it's not a calculator, abacus it is called.
Abacus, right?
Yeah.
Oh, yes.
I'll show you how they do without abacus one. I can show you. Mind. Yes. Let me check if I can play it. I see without that instrument. Can see, right?
Yes, Father.
Without instrument.
Get ready for doing in mind. Set 0, 2, 9, 5, 5, that is? Set 0, 2, 9, 5, 5, 9, that is? Set 0, 5, 6, 10, 13, that is? Set 0, 55, 22, 11, less 33, that is? Set 0, 5, 10, 55, that is? Set 0, 65, less 10, less 5, 23, less 20, that is? Set 0, 5, 10, 20, 50, less 22, that is? Set 0, 2, 1, 5, 20, less 3, less 5, that is? Set 0, 55, 23, less 11, that is? Set 0, 65, plus 10, 10, less 10, that is? Set 0, 77, less 22, less 50, that is? Set 0, 3, 30, 5, 50, less 55, that is? Set 0, 75, less 20, less 5.
Yes, they can go on for an hour or so without stop. Usually when I take up around 45 minutes session, after the session they will ask, no session today, because they have no time to get distracted. Yeah. In the initial stage, 3 months, they will use that instrument. After that, they won't use the instruments. They will use the hands. But after that, next stage, they won't even use the hands. How fast you can dictate till crores, they can calculate. At the speed that I dictate, they will calculate.
So, Father, you're teaching them.
Yeah. That's called master brain program.
So nice.
If the childhood, if they get it, then they never need to by heart anything.
Yes.
Yes. So brain is designed in that way.
Father, you have multitasking, right?
Multitasking, it's all the need in the village. In the villages, we need to do something. These are Paka, pure villages, interior villages. That was a village where, when I reached there was not even a single person who has gone beyond 10th standard studies. Now, maybe more than 10 of them are abroad after the masters.
Okay.
Yeah, and they learn they learn English also. We teach them. They are all from Kannada medium. They don't know what is English, but I'll show you how they teach, how they speak.
This is.
You want to know? 1 month. This child is 1 year 10 months. Okay, doing anchoring.
So then you have got gifted this before. Mother,
It's
you are
just
teaching.
1 year and 10 months. I'll show you one. How they learn English beautifully. It's all not OET, okay?
Yes, Father. Excuse me, Father.
Yes.
Father, if you don't mind, can I ask you something?
Yeah.
Yeah. Father, are you from Bangalore or from Kerala?
I am born and brought up in Karnataka, Mangalore.
Mangalore.
Yeah, first time
Okay.
I am in Kerala for 3 years, last 3 years. I am transferred to Kerala.
Yeah. So, Father, you're originally from Kerala, right?
Now, my forefathers are from Kerala, but I don't know to write and read Malayalam. I know only to speak because I never been in Kerala. Even my parents were in Karnataka. My grandparents migrated from Kerala.
Okay. That means, Father, you know Kannada language, right?
Yeah, Kannada is like Tulu, Kannada is my main language.
Okay. I
What is
know a
that?
little bit basic.
You know, Kannada.
Yes, I know. Yes, I
I'm
studied
just,
there. I did my JNM course from Best School of Nursing, Bellary.
which one? Bellary.
Bellary. Yes.
My younger brother is the syndicate member of Rajiv Gandhi University.
Okay.
And my brother and the sister-in-law both are inspectors of nursing colleges from the university.
Bellary.
My brother and sister-in-law, both of them are inspection team members of Rajiv Gandhi University.
Oh, okay.
You are under Rajiv Gandhi University, right? I'm trying to find one small place to English. Thought will be useful for you, but I am not finding it. It's all casual, okay, nothing to do with the session. I'm just trying to see one where those local people studied English and those kids, how they speak. Like this kid, no? What you saw?
Yeah, weekly once you give online session to our kids, then I no need to teach them for that.
You are learning international English now. You can teach, right?
Yeah, but this kind of mathematics is very difficult.
Maths is very easy. Once you understand the tricks, techniques, once you fall in love with maths, that is the easiest one.
Oh.
Why that is not seen? Maybe next day I'll show you. I can't find it here in my.
Okay, sir.
It's like one small video was there. It would have been I should see how we can learn English. Mm. Right. We can discuss something by the meantime.
Also, can you give tips for the memory improving?
Pardon? Memory
Can
is
you give
always best. Only thing you don't believe that your memory is good. That's all. Nothing to improve.
Although we are forgetting,
Memory is always good.
since we are observing that we are forgetting daily words also. Like,
You don't forget unless you have dementia. Yes. It's all we think we do. If you think and you say that 10 times, you forget. Tatasu. If you have not seen that video, you can see it again. Okay? That is real. Once you say you will forget, you will forget, you will forget.
I think day before yesterday I watched that video. I make a notes. I will post it in the main platform. It's really lines.
Yeah.
Yeah, or
In
like
the subgroups, you can post it if you find it. I may forget. That's the real thing, actually. You
yeah,
believe that.
concentration.
even
Yeah,
to participate that time also, the words, the meaning we know, but that word not coming on tongue. Like,
Which one?
we are daily listening from you also, Father, but sometimes when we are trying to speak or explain, we cannot recollect that word, but we know that that word I have to use, but we forget that. Then, like,
Okay. It's not that actually we forget, but we feel that we believe that we forget. If you say you will forget, you have to forget, right? There is no other way. If you believe that you don't forget, that's what I make the children believe, that they will never forget.
Father, I wish that if you are here, I could send my children to take tuition.
Shall I come there?
Yeah, surely. If you can. I really wish. You are really great, Father. You are really,
We have to do something good for the community.
yeah.
In all the villages,
Yes,
I have tried my level best. Wherever
please
all my
plan online
students.
only. Yeah.
Father, you also like God gifted, I would say.
Everybody is God's gift.
But God has given you extra.
No extra. Just we believe that we can do something. That's all.
Yeah.
Mm.
That everybody not having that things, you know.
Mm-hmm.
We need to believe in ourselves, and we need to have confidence. We need to have faith. Huh? Then only we can really do something for others.
Yes. Okay, I got one here. One. That makes it. So one sec, you can see how they learn. Let me share. Let me share. It's all from the remote villages, okay?
Okay.
Very remote villages. Just
Peaceful
listen
life.
to.
Town.
Yeah.
We are right here in the heart of beautiful Netna. It's situated in Bilinale village, a growing town. The people are mainly cultivators. Rubber plantation is seen in most of the places. Most of the people are engaged in this occupation. A vast majority of the people are educated and employed. Mostly for the higher study students go to the town. In this area, people lead a cultural and peaceful life. Gandhi has said that the soul of India exists in villages and towns. And Lord is there to tell you about our beautiful town, Natana. For that, we can listen to our friend Ajit.
Hi, I'm Ajit of 6th standard. Today, I'm standing in front of our Panchayat. This is our Panchayat. You all know that Panchayat is a committee of 5 senior members of the village. I am so proud to say about our Panchayat. On 12/5/2010, our Panchayat election was held. Mr. Alexander and Mrs. Kumari won the election in our ward. I am so proud of them. In our Panchayat, there are 3 wards. They are Natana, Bilinale and Kaikamba. In Natana, there are 190 houses. In Bilinale, there are 316 houses. In Kaikamba, there are 394 houses. The total members of the 3 wards are 3,501. If you are dividing them into male and female, there are 1,764 male and 1,737 female. I am so proud to say about our Panchayat. That's all. Bye-bye.
Good evening to everybody. I'm here to tell about our beautiful town Natana. At the entrance of Natana, we can see many shops, houses, buildings, etc. There's a bank and a post office. There are 2 chicken farms, 2 hotels, and 2 hospitals and a railway station. In Natana, there are 3 roads which join together. One leads to railway station, another leads to Subramanya, and another leads to Kadapa. There are many vehicles such as bikes, autos, etc. People of Natana are so kind. Visit my friends here because they're so kind and very helpful. In Natana, there are different people with different languages, caste, creed, sex, etc. There are also rich and poor people, but they live without inequality. According to me, Natana is really a God's gift. It's a warm and welcoming town. Everyone should come here and visit our Natana. It's a nice place. Bye-bye. Thank you.
It's very nice.
Yeah, they try to speak as we teach. Yeah.
They are using English as like their native language.
They speak like foreign English.
Really, their accent good.
Yes. They follow foreign accent.
Yes. That's it. That's out of the way. So if you teach your kids before 6 and definitely before 14, that's how you shape their lives. Those children, like one who spoke at the last, they are all in Canada, UK, US, because what they are trained before 14, whatever they feel for life, confidence, communication. After 14 years, it's not that easy to change them.
That's why maybe we cannot change our accent.
Pardon?
After 14 years, so that's why we can't speak like that.
No, we can change. Yeah.